Well, tell me about bypass surgery, stents, angioplasty. Are these optional things, or is this emergency care? Like, how should we think about this?
Well, those treatments are typically emergency care. So primarily for individuals who have coronary disease, the primary indication for a cath and stent is if you're in the throes of a heart attack. We have data showing that for patients with known coronary disease and symptoms of chest discomfort, there's been found no significant difference in medical therapy versus angioplasty, and by and large versus bypass surgery if they have normal pumping function, ejection fraction. So in essence, what you're doing is that in every case you're treating the symptom of chest discomfort. And so you can optimize medication, and they've shown studies where individuals who get stents versus those who just get optimal medications alone, there's no decrease, incidence of heart attack in those who get stents. There's no decrease in death rate. And essentially there's only, symptom treatment of angina, which has been found to be equivalent in a population with known coronary disease. So having said that, there should be a very small number of individuals needing a heart cath or bypass surgery. Now, who might those individuals be? I have a few patients who, for instance, someone has a very specific area of ischemia that's not reversing right away with an aggressive plant-based diet and optimal medications and ECP therapy, which we use to treat ischemia as a non-invasive therapy. Then I may send those patients, a patient I just recently cathed, and we put a stent in his LAD, and it treated a very specific area that was very difficult. It had, lots of calcium, so we had to use very special techniques to open up the artery and the like. So there's specialized cases like that, but that should be very few. We're doing many angioplasties and bypass surgeries that really shouldn't be done because they're done as a first line of care. And so for the most part, these therapies should be minimally used, in my opinion. And many patients have many alternative treatment plans. Obviously, the foundation being a whole foods plant-based diet, but there are other things in addition to that you can treat symptoms with, short of invasive procedures. My practice, in the 20 years I've been practicing cardiology, when I started, I was doing heart caths and defibrillators and all sorts of procedures. And when I started applying nutrition, the number of procedures I do have gone down drastically because we're able to find alternative approaches for patients with these symptoms, and they're able to avoid going in for a heart cath or getting a stent or having bypass surgery.